Hey folks, welcome to Monday. It's the date today, Monday, May 26th, and we're here for Ask a Lawyer Live. I'm David Brannen. Today we're going to be covering some topics around mental illness and applying for CPP Disability, things you want to keep in mind. If you're new here, how it works is I'm going to be talking here for the next 40 minutes or so, maybe up to an hour if there's lots of questions. I can answer your questions. You just have to put them in the chat, in the YouTube chat, and I will keep an eye on them. They pop up here on my screen, and I can answer them as we go through. That's pretty much it. So let's dive into things. Today, I'm going to be talking about, let me bring my comments up here. Yeah, today we're going to talk about the top 5 reasons why mental illness claims get denied, and obviously what you can do about it. This will apply to CPP disability or any other type of disability claim. Let's take a look. We're just going to go through this article. This is an article from my website, Resolute. And I wrote this a long time ago. It's 2019, but it's actually older than that. I think it was just redone in 2019. Probably this article could be due for an update again, but it's an oldie but a goodie. Now, what I start this article out by saying here, I'll put a link to the article too in the chat just so people have it. I'll put it in the chat here. There we go. If anybody wants it. There. So that's the article. The big picture with, even when I wrote this over a decade ago, mental illness at that time was still one of the biggest areas for disability claims, and that still remains the case today. Back then, it was increasing at a much higher rate than other types of disabilities. So there was a lot of concern back then. It's still there today. I don't think it's increasing like it used to. I think it's kind of settled out as a significant share of disability claims. But back then it was a growing area. So there were more and more disability claims coming in from mental illness. And so insurance companies, in response to that, were creating their own, they were creating new rules, new ways to handle these types of cases. And these claims got harder to be successful at. They were denying more and more of these claims because they were growing at such a rate that the insurance company was very concerned of how many of these cases there were, that they had to start to kind of filter them out and only approve cases where they felt there was a significant enough of medical information to support them. All right. Now, one of the main things that you want to think about with mental illness claims is, much more so than any other type of disability claim, even, medical records are really, really, really important. They're more important with mental illness claims because of how you have to show that you're getting the proper treatment. And we'll get into that, but just keep that in mind, that mental illness claims, your medical records are extremely, extremely important because of the way the insurance company manages these claims. So it's possible to be actually disabled because of mental illness, but if it's poorly documented in your medical records, you can still have the claim denied, even though you are legitimately disabled. It will often boil down to that. So let's look at the top 5 reasons here. So the number one reason your mental illness claim is going to be denied is if you are not getting regular care from a doctor. So what that means, regular care means that you are seeing your doctor on a regular basis to manage the mental illness. If you are missing appointments or you're not even going to the doctor, then there is absolutely no chance of you being approved for a long-term disability claim for mental illness. First of all, they will focus on the fact that you're not getting appropriate treatment and that you'd be better, which can possibly be true. Most mental illness is treatable, and it's common for people who have disability from mental illness to recover and to be able to be completely functioning within a job, etc. So if you are missing appointments and things, that is going to be a big problem. So what you can do about this to avoid this problem is pretty obvious. You just don't miss any appointments with your doctor. Make sure that the doctors monitor any prescription medications you're taking, and that if they're not working, that there's adjustments being made or you're trying different medications. And you do need to insist on seeing the doctor on a regular basis, like once a month, whatever is appropriate. But if it can't be a situation where you are not going to the doctor on a regular basis and you're claiming to be totally disabled from work. It just you will not have any chance of being approved for long-term disability, CPP disability, any type of disability benefit. All right. Number 2, this one is not completely true, but it is a reason. Not being treated or seen by a psychiatrist. So a psychiatrist is a doctor that specializes in treatment of mental illness. Now, you don't need to always be seeing a psychiatrist in order to be improved. Family physicians are more than adequate to deal with and treat mental illness. In fact, family physicians treat more mental illness and manage more patients with mental illness than any other type of doctor, including psychiatrists, just because of the sheer numbers of family doctors out there. So I don't want you to think that just because you don't have a psychiatrist that is going to be automatically a problem, but it can be a problem. The insurance company will look and see if your situation is one where a referral to a psychiatrist would be a reasonable step. And if that's not been done, then that is something that can be held against you. So you should ask your doctor whether a referral to a psychiatrist for a consultation is warranted in your case. Doesn't mean you have to go see this psychiatrist all the time, but especially if things aren't improving or if the medications you're taking aren't working in order to get you back to work and this type of thing, then definitely you are going to have to be escalated to seeing a psychiatrist before an insurance company is just going to say, okay, we're going to approve your disability claim for the next 20 years or something like that. That won't happen. They will require a psychiatrist to look at your situation. And if you're not getting one, they may, even if they approve your claim, they will arrange their own psychiatrist to look at your situation to see, are you doing best practices, like in terms of your treatment? What are the other options? That kind of thing. So this is definitely something, if you're dealing with a mental illness claim, that you will want to be on the wait list to see a psychiatrist, ideally. If you're looking at trying to go, if you're trying to sort of cut off reasons that you might be denied. Okay. Along with psychiatrists, there are other professionals that help manage and treat people with mental illness. One would be a psychologist. So a psychologist is someone, they don't prescribe medications, but they do different types of talk therapy with people. And that is how they attempt to try to manage the mental illness. It is recognized as a legitimate and important type of treatment in Canada. So if you are, what insurance companies and CPP Disability will expect to see is that someone is getting both medications and psychological treatment when you have mental illness. If you're not getting psychological treatment, well, it's one thing if it hasn't been recommended by anybody, but if it has been recommended and you're not doing it, then you will automatically be denied for CPP disability and long-term disability insurance. The only exceptions here would be is if you can demonstrate that you absolutely cannot pay for it and you have exhausted all efforts to try to get the treatment paid through the government or some other organization. So it's not enough just to say, oh, well, I didn't do it because I didn't have the money to pay for it. You would have to show that you called around, that you looked, because there are different options for getting treatment covered through the Canadian Mental Health Association. There's different ways that it can be done. So you would have to show that you'd need like a paper trail to show that you've exhausted all efforts to try to get free access, like paid for, that you don't have to pay out of your own pocket, access to psychological treatment. That's where a lot of people will have problems. They can't demonstrate that they really tried to look for alternative means to get it paid for. So what you will want to do is you have to show that if you can attend psychological treatment, then you should do it. If you have coverage and you're not going, then again, that's going to be an automatic denial. People don't go for a lot of different reasons. Like, again, having a mental illness part of that is just impairing your ability to follow up on things and to be diligent. But it is a situation where if you don't go to the treatment and you can afford to go to the treatment, that it will result in a denial. If it can be shown that this treatment could be, like, if it's been recommended by any of the treating doctors, then that's pretty much that's as far as they're going to look into it. If the insurance sees that it's been recommended, or if the insurance's doctors recommended it and you're not doing it and you can afford to do it because you have insurance or you have other means of having it covered, or the insurance company is willing to pay for it, like the long-term disability insurance company is willing to pay for it, and you're not going, then it's pretty much an automatic denial. And not just a denial, but would be a case that would be very hard to get approved if that's what's happening. CPP Disability, they are very fixated on really going through a person's medical records to look for any instances where treatment was recommended and not done by the person. This is one of the number one reasons that CPP Disability will deny disability claims for people who are disabled. They will look for examples where you were offered treatment and didn't do it, and they will automatically deny in those situations. They're actively looking for that. Like, they're just searching and looking for where you dropped out of treatment early or refused to do it, and that they will fixate on that. Much of what we do here at Resolute is trying to identify those situations and try to fix them before your case gets to the tribunal, so that if you've refused this type of treatment in the past, we help arrange for you to go get the treatment and kind of admit the mistake that you should have done it earlier, but you're doing it now. That kind of thing is a big thing that you often have to do in these cases. All right. Number 4. This is an unfortunate one that you may not have a lot of control over, but there is a small number of cases. It's not very common, but there's a small number of cases where you have a doctor or you're seeing a psychologist, but they're not really providing quality care. So they're not meeting professional standards. And the insurance company, they know what the standards are because they pay doctors to review and to look and see, even if this person is seeing a doctor and even if they're getting psychology, they will have their own doctors kind of scrutineer the notes and records of what your doctors and psychologists are doing to see if what your people are doing falls within accepted medical practice. If it doesn't, and usually it does, but if it doesn't, that is a reason they can deny treatment, because they'll say you're getting ineffective care. Now that's a tough one because you don't have a lot of control over it, and it can be quite subjective on what is effective and what is not. So I wouldn't say to fixate on this one, but this can be an area that insurance companies will cite as a reason to deny care. So what you may have to do here is sometimes the insurance company's doctors will make recommendations, and what you would need to do is kind of insist on your doctor or psychologist to review those recommendations and ideally try them with you rather than just outright refuse them. Obviously, your psychologist or doctor would have to agree with the recommendations or agree at least to try them, but that is something you would definitely want to do. You would want to get them to try. Otherwise, you run into a problem where if the insurance company's doctors have made recommendations, you have not tried them. Well, if your case goes to court, the judge is going to say, well, did you ever try these recommendations? And you'll say no. They're like, well, you might have gotten better. How do you know you wouldn't get better if you tried them? This is where the whole thing will start falling apart. And they'll either find that you failed to mitigate by following appropriate treatment, or in the case of CPP disability, if they see recommendations and you didn't try it, it's almost always a denial. Very hard to win that case. That's why, again, when we take on these types of cases, I'm actively looking for these kinds of problems, and then telling my client, like, you have to fix this. Like, we have to get you into a psychologist. You have to, like, you can't leave that as an open loose end when you're doing a CPP disability case, that you have treatment that was recommended that you didn't try. It doesn't matter the reasons. Like, people will have all kinds of reasons. I'll just say, like, those don't matter. Like, the CPP tribunal members and the adjudicators, they don't really care about that. They're going to just look at it like there was treatment recommended and you didn't try it. So you really have to try it, because you can't disprove a negative. Like, it's hard to prove that if you had done the treatment, it wouldn't have made a difference. It's very hard to prove that. But if you do the treatment and it didn't make a difference, then you're off the hook. Like, you've shown that it didn't make a difference. You did the treatment. The reverse is very hard to show, that if you had done the treatment, it wouldn't make any difference. Therefore, to excuse you from doing treatment. The judges and the CPP medical adjudicators and the CPP tribunal judges, they never want to encourage people to not do everything possible to get better. So it's very unlikely that they're ever going to conclude that you were right for not doing the treatment. They don't want to set up a situation where there's any kind of incentive for people not to get treatment and to try things. They want to make a disincentive for that. So the disincentive is your case gets denied, and lawyers and other people will tell you, if you don't try all these things, then your case is going to get denied. That creates an incentive for people to do it. Now, there are situations where it can be objectively shown that the recommended treatment was inappropriate or would have been futile or whatever. Like, that is still a possibility that you could prove. It wouldn't be easy to prove, but it is a possibility that you could prove that. That would not be what I would want to be going into court, hanging my hat on, that we got to be successful on this. Because if you fail on that ground, then the whole case is lost, even if you can prove that you otherwise meet the requirements for disability. The fact that you didn't try this treatment can be a reason that the whole case is lost. All right. So number 5, this is a big one too. So even if you've got good doctors, they're doing the right treatment, if they don't document it, that can be a real problem for you. So it is critical that the people you are seeing are documenting what they're doing. A lot of times, so even if they're doing the right thing, if they're not documenting it, it may be hard for you to prove that they're doing the right thing and cause problems with your disability claim. So it is important that your doctors are documenting the treatment they're doing, your response to treatment, any type of recommendations. Like, they're supposed to be documenting this anyway. It's just some doctors and psychologists are just bad at paperwork and they're not keeping good notes. It's not as big a problem now, but in years past, when they did handwritten notes, it was even worse, because it would be like there would be notes, but you couldn't read them. Almost by design, sometimes doctors would write notes that were so illegible that you just couldn't read them. So again, you don't have a lot of control over this, but it is something to keep in mind, that you do need good notes. So, like, ways you can get around this is you can have your doctor write a report kind of summarizing what their treatment was, your response. So you can get them to do it after the fact, go back and summarize what was happening. That's not ideal. It's better if they have records along the way, but you can always get them to do a summary report, something like that. So these are just some things to keep in mind, things that I've seen with CPP disability cases involving mental illness. The focus of the tribunal and the medical adjudicators is on, have you done the recommended treatment? And is there any treatment that's outstanding that you haven't done yet that could make a big difference? Those are the two of the key things they're looking at. They're really looking to make sure that you've done everything that's recommended, and what, if any, treatment is still outstanding that you could do. And they will look to see how hard have you tried to make it happen. That there's been a recommended for psychology, you haven't done it yet. You haven't refused to do it, but you also haven't done it yet. They will really want to look at what efforts have you taken to try to get it done. Like, it was recommended you go to a pain clinic. I've had this come up in tribunal hearings. Like, it was recommended you go to a pain clinic. Well, yeah, my doctor put me on a wait list. Well, where are you on the wait list? Did you call and check in? Like, well, no, I haven't done anything. Like, they will not like to hear that. So when I have a client, I tell them, before we get to the tribunal, you need to be calling the pain clinic and getting updates on where you're on the wait list, so that you can tell the tribunal, here's where I'm on the wait list. I last contacted them on this date. Here's what they're telling me now. You have to go through like that. If you just go to the tribunal and you're like, oh yeah, well, my doctor referred me to the pain clinic. They said it was going to take up to 2 years. And the tribunal member will say, yeah, but that was 5 years ago. So have you checked in? Like, where does it stand? And the person's just like, I don't know. Like, I haven't followed up. That could lose the case right there, right? That's why I'm constantly looking for these types of issues in a case, so that I wouldn't want a client to show up kind of shrugging on, well, why haven't you followed up with the pain clinic? They said it could be a wait list of 2 years. That was 5 years ago. Why haven't you tried to get on the wait list or followed up or anything like that? And people will say, well, my doctor's supposed to do that. That won't fly. What I would do if I have a client, I will identify that early on after they hire us, and I'll say, you got to get in touch with the pain clinic directly. Like, find out where you're. A lot of times people will call and realize, oh, you're not even on the wait list. They forgot, or you missed so you will want to make sure you're on that wait list and find out, so that when you go to the tribunal, you can give the judge very specific information. Like, I talked to them on this date. Here's what they told me, and here's where I am on the wait list. Here's what they think now. In that case, they will maybe give you the benefit of the doubt, that they could still approve your claim even though there's treatment outstanding, as long as they're satisfied that you've done everything you can do to make that treatment happen. All right, I'm going to leave it there. Let me remove that, and let's see if we have a question. Yeah, we do have a question here. This one says, for approved mental health claim in maintenance mode, how often should one go for talk therapy? So maintenance mode, that's a word that people use to refer to a long-term disability claim that is over 2 years, and you've moved on from disability in your own occupation to disability in any occupation. How often should you go for talk therapy? I think at that point it would really be dependent on your situation. So what's appropriate in your situation? It's easier sometimes early on in a case to say that it should be more frequent, but when you're past the 2 years, it really would be whatever is appropriate for your case, because at that point they've accepted that your disability is permanent usually and not going to improve. So it's often not as critical to keep going to therapy every week or every month or whatever it is, right? So I think there's a lot more latitude at that point on what's appropriate. So I can't really give you an answer. The answer might be you don't need to go at all. Like, because if you've been doing it for 2 years, then maybe now, it may no longer be appropriate to keep doing it. All right. I'm going to check something else out while we're waiting here. I can't read it. There's some new articles out on I think they're behind a paywall. Nope. This one looks like we can read it. So let's take a look at this. Just for those of you who are trying to keep up with the Canada Disability Benefit, let's take a look. Here's a new article out on it. Let's see what it says. I haven't even seen it yet. Let's see what it says here. So this article is from the Toronto Star. It says the Canada Disability Benefit is supposed to roll out in July. Applications have yet to open. Yeah, that is where we're at right now. It says here the lack of information of a dedicated minister in Mark Carney's Liberal cabinet has advocates worried. Yeah, there's definitely not a dedicated minister to this as well, to this program. So people worry that it's just going to get lost in the shuffle and not be anyone's priority. So let's just see what this article is saying. The first payments of the national monthly benefit for low-income people with disabilities are expected to go out in just over a month. Yeah, they're supposed to go out in July. You can apply in June, and the first payments are supposed to be payable as of July, but I've said before, I don't know that you're actually going to get a check in July. It may be like you start the process in June, and by the time they process it and approve it, it will be like January of 2026, and they'll just back pay you. I think that's more likely. I just don't see a situation where people are applying in June and they're going to get a check in the mail in July. That's just not going to happen. I don't think that'll happen. But the Minister for Disability Inclusion and Cabinet advocates are concerned. But without a Minister for Disability Inclusion and Cabinet advocates are concerned how much of a priority this will be. I mean, it may not matter. Some minister is going to be in charge of this, and they could just as easily give it a priority. I don't know that matters, but again, a lot of this stuff with some of my criticisms of the former Trudeau government is a lot of things were done for show and not a lot of substance. So again, I'm not so concerned for show that they have certain ministers. I will judge it by the substance of what they do, because they could be more substance to it and less of a show, because nobody cares for the show. They really want substance. So June is the first month of eligibility for the Canada Disability Benefit, though the first payments are expected in July. I don't think anyone expects payments in July. I think this article is missing the point here. July is the first month of eligibility. I will be very surprised if checks are in the mail in July. I mean, maybe it's possible, but I would be very doubtful of that. I don't know that they're going to be able to process it that quickly, but we'll see. I guess in some ways it's easier to process because if you're already approved. I guess it's possible. Maybe I take this back. It is possible if you're already approved for the disability tax credit, you've submitted your taxes, you got your application in. I guess it is easier because they're not having to review your case. It's not like CPP Disability where they got to go through your application and do all this. If you're already approved for the disability tax credit, it could happen in July, maybe for some people, if you've got all your ducks in a row. But I still would be surprised if it happened that quickly. I think it's more going to be that you'll be approved. You'll get it approved like a few months later, and they'll retroactively pay you. I think that's what's more likely. Okay, it says here, Employment and Social Development Canada, the department responsible for the benefit. That's also the department that has Service Canada under its kind of purview. Said a firm date for when applications will open has not been set yet. Oh my God. So it's May 26th, and a firm date has not been set. Like, oh no, what's going on here? But is expected to launch by the end of June. Okay, so basically what they're saying is by June 31st, you'll see this thing, or June 30th, whatever the last day of the month is. And said the benefits webpage will be updated in the coming weeks. Okay. The benefits webpage, we've been there before. Yeah, so this is I kind of agree with this. With tariffs, the economy, Canada's relationship with the US being a top priority, these other issues are kind of being swept to the side. Yeah, like including almost every other issue as well, when these things have kind of taken over everything. So, but the good news is that there is some good news here. And I don't know if this article is going to bring it up, but the legislation itself put deadlines for things to be done for this very reason. That is one of the smart things that they got put into the legislation, so that it just couldn't go on forever. They argued it to get these deadlines of things that it had to happen by a certain date. So come hell or high water, they have to, come hell or high water, people will start being eligible for this benefit as of July. Even if things get delayed, say the application stuff gets delayed or slow, whenever it does get into effect, it will retroactively pay you until July. So that is something that got put in the legislation when they passed it for this very purpose, that people were worried this law could get passed to do this, and then nothing would require it to be implemented, because you can pass laws, but then it can take forever for a program to be set up, for this thing to be done. It can get stalled out and nothing ever happens. They put these deadlines in there to try to prevent that. Yeah, and the advocacy groups are upset that there was not a minister assigned for disability inclusion. Yeah. Again, I would say I agree to a certain extent, but also a lot of what the previous government was flash over substance, in my opinion. So again, like, it took the last government forever to get, like, they were talking about doing this program in 2015 and they barely got it over the finish line here in 2023 or whatever it was. So again, just because there's not a minister assigned to this does not mean it will not happen. Because quite frankly, a lot of this stuff is done by people below the minister. So there's someone in charge of this program who is reporting to some minister. So that person is really driving a lot of this, quite frankly. So let's just wait and see. I agree that it would be ideal to have a minister responsible for disability inclusion and et cetera, but it would be ideal, but it's not there. So let's just wait and see what's going to happen. Yeah, exactly. He recognized that having a dedicated minister won't guarantee success. I agree. But not having one will guarantee that things are going to be worse. I don't agree with that. I don't. Because again, like, a lot of these things in the former government were just there for show, just as a hollow gesture in some situations. So it doesn't really matter. It doesn't matter if you have a disability inclusion person, minister, who no one listens to or gives any time, right? It's just a shallow gesture. So let's wait and see. Let's wait and see. Cross our fingers here. I'm not gonna agree with this statement. We'll have to wait and see. Is the disability benefit strong enough? Well, that is $200 a month is not a lot. I don't think anyone could disagree with that. But they have budget limitations and things. So again, this is where it starts. They can always increase it. I doubt it's going to be decreased over time. Right now, it's set to increase with inflation, and they could always increase the base rate depending on where we are as a country. But I think the most important thing is for the current government to get finances under control, because I think the last budget, it was 60 billion, a deficit of 60 billion. So if you're running deficits of 60 billion, these kind of programs are always going to be given very little expansion because there's no money to do it. I think there is money to do programs like this, but they're going to have to get the budget itself under control and figure out where the priorities are going to be. Because you can't have a deficit budget forever. Yeah, again, it says here, the purpose of the benefit was reduce poverty and support financial security. Again, these were hollow statements made by the government that got people's hopes up, and then they did not deliver on it. So again, like, I'm more interested in what is the real actions we can get done rather than hollow statements, because they absolutely got people's hopes up with this benefit by the way they were talking. And maybe Paula Qualtrough, I do remember when she was in charge of this, and she was taken out or resigned. I don't even know what happened, but near the end, she was the one that had seen this program through most of the way. And then I often wonder, did she resign or did she get taken off this for advocating too much? I had no idea what happened. It was strange though that she was taking off this portfolio in a shakeup of cabinet right near the end. So I don't know if she was taken off because she was underperforming or demanding more, or maybe it had nothing to do with it at all. If anyone has any idea, let me know. But it was interesting that she was taken off of it. But what they said when they were putting this together and what they delivered is so far apart that they really got people's hopes up and then just left everyone disappointed. The only thing that they did was actually have a program. So they do have a program. Again, this was a football that went through 2 elections. They ran 2 elections on this, and it should have been done Trudeau's first term after 2015. This should have been done then, but it wasn't. It was pushed into the next one, and then it was kind of done barely crossed the finish line to get this thing done. But it did. It got done. So I can't criticize that. It is not ideally what everyone wants, for sure. Okay. So yeah, the person they're talking to is also raising concerns about the possibility of provincial governments clawing back the benefit. That is a real concern. In fact, I think Alberta has confirmed they definitely are clawing back the benefit. Now, on the other side, in Alberta, people's benefits in Alberta are much higher. For the provincial benefits are much higher than anywhere else in Canada. So again, it's all relative. I'm sure the people in Alberta don't feel that way, who are getting a benefit. They would rather have this extra. They don't care that their benefit is slightly higher than Ontario and everywhere else. It's still, you know what I mean? It's still a situation where they need the extra money. The Liberals included plans to reform the disability tax credit. Ugh. Oh boy, I didn't really read much into that. I don't know what that reform it in what way. That's something I'm going to have to look into. I'm not sure how they were going to reform the disability tax credit. Interesting. It's a lot of paperwork. Well, I wouldn't call the disability tax credit a lot of paperwork. It's like one form you fill in. So compared to other programs, I don't call it a lot of paperwork, honestly. I'll be quite frank. But again, this is all relative. Compared to other programs, it's a lot less paperwork. So the disability tax credit is not a lot of paperwork, in my opinion. But again, people are coming at it from a different point of view. It does require a physician. Yep. But when you're trying to certify someone with disability, like what else can you do? You do need some type of, you can't just take people's word for it, or there's going to be like massive fraud with this program where people will intentionally lie in order to get this benefit. Unfortunately, there are those people in our society that are going to steal from others who are deserving of it. So there does need to be some gatekeeping where you have to fill out this form and have a doctor certify that you have this level of disability. There's not really a way around that. Without that, you're going to have people, just because a lot of disability is subjective, you're going to have people scamming the system. So it's unclear what a reformed disability tax credit might look like. The Star contacted the Prime Minister's office but did not get a response in time for publication. Okay, so the person they were talking to said that they should streamline it so that people who are already qualified for provincial disability benefits, like ODSP, for example, are automatically eligible for the disability tax credit and Canada disability benefit. Yeah, there could be a world where that is the case. The unfortunate thing is right now those programs are set up quite differently, and the only thing common is the word disability between the disability tax credit and the Canada and the ODSP. So provincial disability benefits and the disability tax credit, they share the word disability, but the type of disability they're looking at and the circumstances are quite different. Like provincial disability is really focused on capacity to work, whereas the disability tax credit does not care about capacity to work. It looks at impairment with activities of daily living. So it is not you. It is really an apples and oranges situation. And yeah. So, but again, I don't want to say there's no way they could be streamlined, but it would be a very difficult thing to streamline because you're also talking about a benefit that's administered federally and ODSP is administered provincially. So how are you going to get all these people on the same page? Like it's unlikely they're going to be able to streamline it like that because you have all the different provinces and territories have different, although very similar, but different requirements for their provincial benefits. It's very difficult to totally, get that integrated with a federal program like the disability tax credit. Add to that the complication that the disability tax credit focuses on different aspects and elements of disability than these provincial programs and CPP disability. All right. We got another question here. If one is already approved for the disability tax credit, will the doctor still need to complete a form for the Canada Disability Benefit? That's a great question. No, I don't think so. In fact, I'm almost certainly no. The only requirements to get the Canada Disability Benefit is to be approved. So be approved for the disability tax credit, have filed your income taxes for the year before, including your spouse, if you have a spouse that you've both filed, and be between the ages of 18 and 65, and 4, have an income that is below the threshold that you can qualify for benefits. That's it. Those 4 things. So you won't have to do another medical for it. You have to apply. Like I think they're not just going to automatically approve people. You have to apply. So you still will have to put an application in, and you'll probably have to check the boxes like, yes, I filed my taxes, and you will sign an authorization allowing them to double check with Revenue Canada. I bet that's what I'm expecting. There's going to be a box where you check, yes, I am approved for the disability tax credit, and you sign a thing that allows them to check with Revenue Canada on that, and then they will then verify what your annual income is by just going to Revenue Canada and getting that information. Okay, here's a question from Lee. What does this say? How long do you need to be on LTD to generally get CPP disability? Do they want to see your medical condition stable for a few years? That's a great question, Lee. There's no real timeline for how long you need to be on long-term disability to get CPP. It really depends on, like, CPP disability can only be approved when you have a disability that is severe and prolonged. That is defined as being unable to do any occupation, and having a capacity to earn income that is less than like $20,000 a year. The thing with long-term disability is for up to 2 years, you can get long-term disability as long as you're just disabled from your own occupation. So being disabled from your own occupation, while it can qualify you for long-term disability for 2 years, it will not qualify you for CPP disability. So in some instances, yes, you do need to wait a little bit, not just to see if your disability is going to be stable, but to see, is it going to be a disability that prevents you from getting back to any other type of occupation? Because during the first 2 years on LTD, people don't have an incentive to go try to get some other job because you're going to be paid LTD if you can't do your own job. And the purpose of that is to give people time to do rehabilitation, to get treatment, to get well, to go back to their own job, rather than forcing them to quit and go out to the labor market and find some other job. So those things are at play. Now, some people on long-term disability, even though they're in the own occupation phase, it can be apparent to everyone, and the evidence would support that you really can't do any occupation and there's no sign of it getting better, then in that case, you could apply for CPP disability. But generally, I tell people, like, you do need to wait. Like, for CPP disability, you will want to see if this is something where you've been off work. You have to be off work at least 4 months for CPP disability. But if you're still getting active treatment and there's things going on, it's going to be very hard to prove to CPP disability that you're going to meet the prolonged requirement, because there's still a lot of active treatment. A lot of doctors early on are still very optimistic about people getting back to work. So if there's any kind of optimistic statements about that, you're not going to get approved for CPP disability. So practically speaking, people who are on long-term disability generally are going to get approved for CPP disability if they're closer to the 2-year mark. Now, that being said, there are many long-term disability insurance companies. The trend is for them to get people applying for CPP disability earlier and earlier. So if they identify you as someone who might have a longer term claim, they will try to get you to apply for CPP disability as early as possible, often sometimes inappropriately early. And I can get into the reasons for that, but basically it's financially advantageous for them to have you apply for CPP disability as early as possible, because that would mean if you eventually get approved down the road, you'll get further back pay, and the long-term disability insurance gets all that back pay. So you can only get back pay going back a maximum of 12 months before the date you apply for CPP disability. So as you delay the date of applying for disability, you're going to lose out on some back pay there, right? So if the insurer has been paying you for over a year, and you then apply for long-term disability, they're going to lose out on some back pay. They want you to have your application in before a year. That way, if you get approved, the back pay will go back and cover the full year that they've already been paying you, if that makes any kind of sense. If people aren't understanding that, I can try to explain it better. But so those are things to keep in mind if you're going to do CPP disability. All right, let's go look at the forum, see what's going on there. I haven't checked in. Oh, wow. Yeah, I haven't checked in here for a few days. So let me stop sharing and reshare. We'll answer one or two of these questions, then I got to hit the road here, unless people have more questions. This one says, no recent contact with provider. Let's see what this one says. So I've been on LTD quite a while, past the 2-year mark, and my insurance always sends a regular questionnaire every few months, which is expected. This time it's been almost a year. And while I do not miss them, this makes me think, is this common? Yeah, I think it is common for this to happen. I'm going to respond. Let's see what Caro is a very common user here who says usually has very good advice. Usually you shift into annual updates unless there's some reason. I had a crappy, incompetent claims manager for a while, so I'm happy to be put on auto and forgotten. Yeah. I do prefer to be forgotten, but this is my first time. It's been almost a year. Makes me suspicious. Yeah. I'm going to say here, this happens and is not unusual. It could be a situation of being so generally people get an annual form to fill out. I expect at some point they will start sending those to you. No need for you to reach out to them. Actually, I'm not going to say that. I don't like giving people direct advice because I don't know their whole situation. So there might be a reason for them to reach out to them. So I would say I would only recommend a person reach out to the insurer if there has been some change in your health, the treatment, work situation, etc. Otherwise, just keep seeing your doctor and doing whatever recommended treatment you have. All right, we got some typos here. Too lazy to retype, so we're just going to do the old. I'm going to have to do that one. Yeah, there we go. So this can happen. You kind of fall through the cracks. It's usually better just to not do anything, honestly. And it could just be an incompetent manager, unfortunately. Another question from Lee. Lee says, what type of supporting docs are necessary or needed for CPP disability? Just the doctor filling out the application or my whole medical file for 6, 12 or more months? Okay, this is a good question. So first of all, if you had my book right here, you would know the answer to this. So Lee, if you have not already done so, I'd recommend you download this. You can get it. You can download a PDF copy right in a link that is in the bottom of this description of this video. So the answer to this is usually you want to provide more than just the doctor filling out the form. What I look for is, in terms of, I think it's important to provide the whole medical file. So if you want to do an ideal application, you would want to give the full medical file from your family doctor. How far back you go depends on your medical history and its impact on your ability to work. So at a minimum, I try to go back at least 2 years from whatever date it was that you stopped working. So you might have a case where somebody approaches us and they stop working back in 2016 and they're late in doing their CPP application. We would still go back to like 2014 to get records. I want to see medical records for at least 2 years, sometimes more, but at least 2 years leading up to whenever you stopped work, so that you can show, because sometimes the records help you. They will show you getting worse over that time. And it'd be very important to show like what was happening in the lead up to you stopping work. And the medical records can often help that. And even if they don't help you, sometimes they don't really help at all, but the medical people still want to see them. So the medical adjudicators still want to see it, and the tribunal judges certainly would still want to see it. That's the ideal. You don't have to do that. Most people don't do that. Most people will just submit their application and get their doctor maybe to write another letter. Or actually, that's not true. They'll just submit the application, and then if it gets denied, they'll then get their doctor to write another letter. Okay, another question here from Juan. This one says, is AI helping insurance companies gather more information about claimants and denying claims, or not yet? AI is definitely being used by insurance companies. So it's not necessarily to gather more information about claimants, but they're probably using AI. I think the more way they're using AI is they are using it to analyze claims, because I'm using it. So I know insurance companies are using it. Well, I'll look at the camera here, looking off to they're definitely using it to analyze claims, to identify, like I talked about, identifying gaps in information or any red flags. They're using AI for that. They would be using AI to determine trends or patterns, but they're definitely using AI to analyze. So they would use AI to analyze your medical records, and AI would be able to analyze it and tell you, is this treatment following standard practices in Canada for this type of medical condition? That kind of thing. So they're definitely using AI. I don't necessarily think they're using AI to like search up your information necessarily, because that's not, I don't know that AI would be that effective for that, but it definitely would be effective at analyzing all the information that you give them. And they would use it to deny claims. Yeah, AI is changing everything, honestly. Even the amount I use it, it's unbelievable how much what I'm able to do now with AI. that I can just imagine where we're going to be in a few years. Like I use AI for legal research now. I use AI to help draft briefs, letters, emails. Like AI is very much changing how everything is done right now in the legal and disability claims world. Now, what you need to be careful of is what you'll find now is like you now have the ability with AI to write a very good on the surface, like appeal letter to identify arguments you could make. Like anybody has that at their disposal. But where you run into problems is that AI still at this point is making things up. So you can't trust the law. Like I have people contacting me and saying, look, I've already asked ChatGPT, there's this, there's that, the other thing. And sometimes it's correct, but it also, ChatGPT is not 100% on getting the law correct. And in fact, it still to this day will make up legal cases. So you need to be extremely careful when using AI. It will make up law in legal cases to support its own arguments that it's making, and those don't exist. So this is the problem with it. It looks very official. So you need to be extremely cautious using AI right now to do legal argument type documents where you're citing legal cases and legal precedents, because AI, it still makes them up. Some lawyers have gotten in real trouble over this. It's a real problem because if you can get AI to help you write a legal brief, but it will cite cases that don't exist. And it's very convincing. You're like, wow, these are perfect. Well, they don't exist. That's why they're perfect. It will sort of craft it up. And sometimes it will cite cases that don't exist, but the point that it's citing them for is not correct. Like that is not what the case says. So again, just word of caution with it. But I'm not going to, you don't throw the baby out with the bathwater. There's still a lot of things that AI can do to help with disability claims on both their side and our side. Okay. Sherry's saying, what is Sherry saying here? Lee, get David's book. It helped me immensely completing the application. Absolutely. Thank you, Sherry, for the shout out. So just so you know, Lee, this is the book here. And I do have it's here somewhere. I also have another book that helps with the application itself. This is one tells you more generally about CPP Disability Program. And my other book is just a workbook focused on, I don't see it here. Yeah, I don't know what I did with it. The other book is just focused on, it's an application workbook. Anyway, it's around here somewhere. All right. I'm going to stop it there just because it's getting close to the hour. This was a great, seems like Monday's the best day. I get the most engagement of people asking questions on Mondays, but we'll be back tomorrow talking about long-term disability. I'm not even sure what my topic is, but I'll have it posted. And then Wednesday, I'll be back talking about employment issues and taking questions about that or any other topic that you like. Thanks, everyone, for joining me today. And I will see you tomorrow. Take care.